Hello and welcome, folks, to the second session of our Supervisory Foundations, Strengthening Supported Employment and Housing Services series. My name is Amy Banco. I am a faculty member within Rutgers University's Department of Psychiatric Rehabilitation and Counseling Professions. Very excited to have you all here today to deepen our understanding and knowledge about supervisory practices. For those of you that are coming into the series, maybe you didn't attend the first session, that is okay. This three-part series is aimed to support supervisors, whether current supervisors, up-and-coming supervisors, well-established supervisors, new supervisors, or again, people aspiring to supervise, to build your skill sets, right? Supporting staff, cultivating work environments, building effective vocational and housing programs that yield hopefully positive outcomes for the people in service. Today, we're going to be focusing on the critical role of clinical supervision within FCS services. And we're going to really explore supervisory models and modes of supervision. When we think about supervision, it's not just oversight, it's really building a trusting working alliance, a relationship designed to promote professional development, ensure quality services, and protect the well-being of both the individuals in service as well as the supervisees. And we really, focus this training on evidence-based practices, blending different communication approaches to strengthen your supervisory skills. Today's webinar is hosted by DBHR through the Washington State Healthcare Authority. Again, this will be an interactive training, and we are encouraging you to ask questions, participate in the session, participate in the breakout room activities, where you can have more time and opportunity to meet with your virtual colleagues and enhance your learning through application. Please note that the use of automated note-taking bots, similar tools during Washington FCS events or meetings requires prior approval. Unauthorized use of such tools is prohibited to ensure the privacy and confidentiality of the attendees. Any recordings that are created through AI is not a recognized official recording of the session, and Washington State reserves the right to exit trainees from the training if they're using AI to take notes without prior approval or using AI to record the session. Please note that the materials for today's session, the recordings, are no longer emailed to participants. In the past, that's what the Washington State Healthcare Authority has done. Materials will now be uploaded to the chat during today's session, and that I will upload PowerPoints and the handouts in the chat for your utilization and downloading. The recording of today's session will be available on the HCA FCS channel, and that is the Foundational Community Support YouTube channel. Foundational Community Support FCS YouTube channel, and that should be available within approximately 2 weeks of today's session. Just some basics before we dive in. Keep your microphones muted unless speaking, and feel free to use the chat box to engage. Also remember that we want to just be very mindful of connection and interaction in our virtual space. We want to maintain respect and empathy and kindness for our colleagues as we go throughout today's session. We really want to model that good communication approach and kindness for everyone and their unique identities that they hold in this virtual space. And one key feature of the series is that we're going to move with intent. And that intent is to apply to practice. If you are a current supervisor, again, new or seasoned, if you are someone aspiring to mentor, to supervise, right, we're asking that you apply the content moving forward. The 3 objectives for today's session, we're going to recap and reinforce understanding of the foundational supervisory model from last session. We're going to explore how supervision can look and feel different across modalities, including individual, group, and in-vivo supervision. And we're going to hopefully apply some of these approaches in activities, discussions, worksheets that we'll be engaging with. Um, Anything that you would like to see for today's session, put it in the chat. Any objectives, agenda items that you would want covered. You can go ahead and put that in the chat. I know your time is so valuable. You are working so hard and diligently um, in your organizations. I want to make sure that this is a meaningful session, right? You could be anywhere these 90 minutes, and I want to ensure that I'm meeting your needs and the things that you're anticipating covering within today's content. So if anything comes up, put it in the chat, circle back. I want to make sure you're getting the most out of your time here today. Okay, so thinking about supervision. Supervision is a moderating factor for staff, right? Supervision doesn't just shape performance, it shapes staff's workplace experiences. In many programs, right, FCS programs, the quality of supervision can be one of the strongest predictors of staff satisfaction and staff retention, right? Supervision can impact retention or turnover and staff satisfaction. Research shows that high quality supervision moderates how staff experience the demands of their work, right? Um, Wallbank and colleagues found that reflective, structured supervision increases staff satisfaction and enhances perceived support and strengthens commitment to the organization. In a follow-up study, Lindo and colleagues found that this evidence with the concept of wellness sustainability, showing that supervision contributes to ongoing professional engagement and builds internal resources that staff can use to remain effective and connected over time. And so supervision isn't just a compliance requirement, it's a workforce stabilizer. When it's consistent, intentional, balanced, it can directly influence work culture, staff morale, staff person's confidence, and organizational environment, as well as tenure and loyalty. So using the chat, um, let let me know, right? When supervision feels energizing or motivating to you, what's happening in those conversations? Think about supervision that you had. When it feels energizing or motivating, supportive, what do those conversations look like? You can type a few words in the chat. What makes those sessions work? You'd like, you can unmute, you could put in the chat, but what feels energizing, motivating to you in supervision? When staff have pointed questions and they're seeking guide, yeah, Sarah. So it can be very motivating when people come in prepared and they're looking for feedback on specific things that you can focus your efforts on. Being supportive, yes, working when there is a collaborative approach, when there is a positive environment, that is so profoundly important. Absolutely. Feeling empowered to take calculated risks. Yeah, knowing that trying a new intervention, right? Working in different modalities, building our professional skills can feel risky, and having that empowerment, that support to do so, right? Allowing to run with ideas, that can make us feel valued and heard, that we are contributing meaningfully. I love that. When it's informative, idea driven, collaborative, absolutely. Right. Worst thing we can do is spend 60 minutes in supervision and that session doesn't offer new information, support, new ideas, or it's collaborative, right? That is the opposite of energizing. When they show value to my contributions. Yeah, when we feel valued, that can it really motivate and enhance our job satisfaction, our commitment, the work that we do. Consistency, yeah. When, research shows that supervision tends to become less frequent the longer someone is at an agency. Thinking, right, the thought process behind that is, well, this person is a seasoned staff individual, right? And they don't need as much supervision. And so it becomes less frequent, less consistent. And what research actually demonstrates is that when you're titrating down and you're not meeting the need of the staff person, they can feel really unsupported, abandoned even in the work that they're doing. And so, yeah, consistency is key, even for seasoned staff, right? We have to think about how do we titrate meaningfully and still offer the support that they need. Love that. Open to feedback for development versus being defensive. And we're going to talk a lot about that today, right? How can we, as Sarah's noting, really be collaborative, talk about feedback in productive ways that hopefully won't elicit that defensiveness. Celebrating successes, no matter how small. Yes, absolutely. When we are in sessions, supervisory sessions, and there is an absence of those acknowledgments, the work can feel maybe a bit de-energizing, right? We need to keep our perspective balanced in the work that we do by acknowledging strengths, successes of staff, successes of the people in service. Those things can fuel our compassion satisfaction. Amazing. I love that you guys are thinking really deeply on the things that, strategies, approaches to build, right, energizing, supportive, collaborative conversations. Um, Thinking about approaches to supervision, it's really important that we pull from evidence and best practice. And the model that we use within the Department of Psych Rehab and the model that I have used in my own practice comes from Enola Proctor. This is a three-prong or three-function model of supervision. And so we can use this framework, right? This is a clinical framework for professional supervision to engage in the conversations we were just alluding to. Enola Proctor divides supervision into three core functions. That includes the normative, formative, and restorative supervision. Let me see if I can. Right. And these functions have different aims, including managing accountability, fostering learning, and providing support. This model was derived from counseling and social work supervision traditions, and it aligns with earlier frameworks, but is presented.
Yes. Yeah.
Yes? Oh, did you have a question?
Oh, no, sorry about
No, no worries. I just want to make sure I was getting to you if you had any follow-ups. But thinking about Proctor, right? It's important that we utilize all three areas, right? To be effective in supervision, we must address all three areas to ensure that supervision is high quality. It's addressing service provision needs, professional development, as well as practitioner well-being, right? Both supervisor and supervisee share that responsibility in that process and engaging collaboratively to be able to kind of reflect on practice, develop skills, uphold standards, and so let's take a deeper look at these core functions. Normative supervision is a function that centers on oversight, ethical practice, and quality control. Think about this as accountability or managerial supervision. In this function, we are monitoring, evaluating a staff's work to ensure it meets professional standards. It adheres to organizational policies, and we are looking to safeguard the welfare of people in service. The supervisor's normative role includes tasks like reviewing um, documentation for compliance, right? Looking at code of conduct, potentially giving corrective feedback, serving as a gatekeeper for the profession. And this aspect of supervision supports delivery of high standards of ethics, safety, and effective service provision, right? It enhances performance through accountability. Normative supervision really is, in essence, that like professional accountability, helping practitioners align with regulations, clinical guidelines. This is where people typically default to in supervision, this normative supervision, looking at progress note completion, goal plan completion, right? Whether things are meeting billing or funder requirements. If we stick to solely this form of supervision, we're missing the big picture. We're missing 2/3 of the other supervisory functions that are just as, and in some instances, even more essential. Formative function is teaching and training dimension, and it focuses on developing the supervisee's knowledge and skills and professional identity. And we use discussions of individuals, modeling interventions, role playing, coaching, constructive feedback during this particular phase of supervision, where the supervisor helps the practitioner reflect and learn from their work. Formative supervision really enables participants to continue to develop professional skills, right? To grow in their practice, to adhere to evidence-based practices. Activities in this domain would include exploring or reviewing clinical techniques, exploring interventions, theory, practice, research, and applying that research to your practice, encouraging service conceptualization, critical thinking, identifying areas for further learning or credentialing, right? This is all about the professional identity and developing those important skills. And it can be key in enhancing service provision. And then we have restorative supervision. Restorative supervision is one of the most underutilized forms of supervision. We do not see supervisors providing restorative supervision frequently, and this function is critical. This is when we emphasize support, encouragement, emotional well-being of the supervisee, recognizing that the work that we're in, there is a hazard to being in the helping profession, right? Where we can experience emotional impact from the work, right? Where there can be stress, there can be burnout, there can be exposure to trauma and vicarious trauma. And so this piece of supervision, restorative supervision, really helps to meet the staff's needs of the emotional toll of this type of work. I want to be clear, this is not counseling the staff, right? This is not providing services to staff. This is our due diligence as supervisors to check in with a person's wellness and self-care in managing the mental load of the job. So in restorative supervision, the supervisor offers validation, empathy, support to the supervisee, exploring maybe their level of burnout, maybe referring them to services, right? Like the internal supports for staff, right? The counseling services offered through HR, right? Helping a staff person to explore usage of time off, supporting that practitioner in providing care and a time and attention to the emotional toll of the work, really to help foster resilience. I'm going to put into the chat the first resource for today. Please download this resource for your use. This is a checklist that will help you to explore how are you engaging in these different facets of supervision. How are you engaging in these different facets of normative, formative, and restorative supervision? And I'm also putting a worksheet that we utilized last session, which is a supervision reflection worksheet. And that helps you determine how much time you're spending in each area. I wouldn't be surprised if people were to reflect, and you can put in the chat now. Where do you spend most of your time in supervision? If you're a supervisor, reflect on how often you provide normative, formative, and restorative supervision. Put where you spend your most time as a supervisor. You could put N for normative, F for formative, or R for restorative. Where do you spend your most amount of time with supervisees? And if you're not yet in a supervisory position, put in the chat how often or what your supervisor is frequently providing for you. Is it normative supervision, focusing on compliance and documentation? Is your supervisor providing you with mostly formative supervision? I'll go back to that slide so you can use it to reference, but put in the chat, where do you spend most of your time? R for restorative, N for normative, or F for formative? Normative mostly. Yeah, but all three are used weekly. That's amazing, Shelley. Thanks for sharing. Thanks for reflecting on your practice. It's great that you are able to see some of these things arising throughout the week. Yes, supportive, normative. Yeah, and a little bit of the formative. Okay. Sarah, about 25% of restorative. I'm glad to hear that you're using that restorative function. That is often a crucial piece that's missing, right? Supervisors use normative mostly, but does use others as well. Yeah, that can be a default for a lot of people, right? Is the documentation done? Um, what are the goal plans looking like? Progress notes looking like? Did you come in late the other day, right? Like looking at some of those like compliance QI functions. And that serves a purpose, of course, but we have to blend and braid in these other areas. Supportive and formative tend to be the dominant vibes in the workplace, a little normative. That's great to hear, Rachel, that there is a lot going on in terms of building counseling skills, communication skills, interventions, and that restorative function. Fabulous. Okay, so we're going to do our first activity. I know I mentioned earlier that we're going to do some breakout rooms to apply. This first activity is going to take place in the breakout group room, and you're going to use a Google Doc. Some of you may not have access to Google Doc at your workplace. Hopefully, one of your partners in your group will be able to access the Google Doc. And that person that can, please share. You can share screen in your breakout group rooms. You can share screen of the Google Doc. In this Google Doc, you're going to be asked, right, specifically to think about, right, the experiences within like the last couple of weeks in regards to supervision. And as you're thinking about those experiences, you're going to label whether those experiences, the examples that you're coming up with, fall under normative, formative, or restorative supervision, right? So maybe you're thinking about a supervisory interaction from 2 weeks ago, where you were talking to someone about how they were really feeling overwhelmed. Maybe someone was in crisis that they're supporting, helping find work, or a tenant, and the staff person was really feeling overwhelmed about that individual in crisis. And so you'll just talk about, right, that discussion that they had with their supervisor. What Proctor function is it? Normative, formative, or restorative? Um, and then you can document that on the Google document. I have, I think, like 7 groups, but you probably won't need that. We'll probably do only like 3 groups of 6 to 7. All right, any questions? Please open that Google Doc before I put you in the breakout group room. We'll do 3 rooms, so 6 participants per room, and hopefully someone can share screen so that you can work collaboratively on completing the form for your group. If you're room 1, use group 1 form. If you're room 2, use group 2 form. If you're group of room 3, use group 3 form. And again, you're just going to go through interactions that you had, categorize them, and discuss a little bit why they fit in that category. And then we'll come back and talk about some themes, what came up, right? See you back in about 10 minutes and be prepared to chat about what came up. Let me know if you need help getting into your room. Okay, so we processed our group exercise and we're now talking about burnout and using the professional quality of life to mitigate burnout. And again, the ProQual is a free resource that you can use to assess using that restorative supervision feature, right? If a person is experiencing high levels of compassion fatigue, burnout, secondary traumatic stress, and it also measures, which I love, compassion satisfaction. Compassion satisfaction, we don't talk about that a lot. This is the pleasure that we derive from being able to do our work, right? The value that we get, the joy that we get from doing the work that we do. And that actually prevents or wards off burnout, right? When we are having high rates of compassion satisfaction. And this tool measures it. So again, please use this resource. I'll put that link in the chat. It's completely free. And you can encourage staff to use it. You can use it yourself. And now we're going to move into communication techniques. At the heart of supervision is communication, not just what we say, but how we say it. And one framework that has proven very assistive in emotionally charged, hierarchical, or value-laden conversations is NVC, or nonviolent communication, developed by Marshall Rosenberg. Nonviolent communication isn't about being soft or ignoring problems, or reducing accountability, or steering away from challenges. It's about being clear, direct, and compassionate, even in the face of conflict. In supervision, this means replacing judgment with curiosity, blame with inquiry, and criticism with clear requests. And it's especially critical when discussing staff performance, navigating disagreements, or exploring emotionally charged topics like burnout or person-served crisis, or, maybe for some folks, compliance issues. The 4 components of nonviolent communication include observation, stating what happened just very factually, expressing feelings, right? Naming emotions rather than masking them, expressing need, right? Looking at the unmet values or conditions beneath that, or between that emotions, and then making a request, asking for concrete actions. And when supervisors communicate this way effectively, they foster environments where staff feel safe and where accountability is grounded in respect, right? Again, if we look at this more closely, we can see that there are 2 pillars, expressing, right? Expressing or communicating something to somebody, and then receiving empathetically through the same 4 components, which is observation, feelings, need, and request, right? And this is a great way to support difficult conversations, right? This approach can really preserve dignity, promote collaborative problem solving. Um, and so let me give you an example, right? Instead of saying to someone, you didn't do this right, and saying it sternly and, or, you, you can't seem to fix this, what's going on, right? Taking all of those like judgments out, taking the emotionally charged terms out, using this approach would look like, I noticed that your progress notes weren't completed within 24 hours. That's the observation. The feeling, I'm concerned because timely documentation supports our billing need. So I'm concerned is the feeling, and then timely documentation supports the billing funder needs, right? Would you be open to discussing what got in the way and what might help going forward? That's the request, right? So I noticed the notes weren't done within that 24-hour window. I'm concerned because timely documentation is important for billing. Would you be open to discussing what got in the way and what might help going forward? That is nonviolent communication. It's not ignoring the problem. It's removing ineffective conversation or communication from the conversation. It's literally opening up the conversation to have more effective dialogue and to problem solve. What do we think about that? This is also on your checklist for supervision, using nonviolent communication to navigate difficult conversations. Any thoughts about this approach? You could put in the chat, you could unmute.
I love this, nonviolent communication. I think it's so important to just remember to be observant and recognize, what that person may be going through because sometimes, like we had talked about just previously with burnout, we don't, the individuals may not even recognize that they're in kind of that burnout mode. And so if we're
Yeah,
always taking the approach as supervisors to just observe and understand and ask those follow-up questions of like, well, what do you need support with? What is getting in the way? What's the barrier? I think it's something that we practice very regularly with clients as well. And so just to be mindful of that when working with others, just all around.
yeah. I think that's a great point that we can utilize these different tools to kind of be curious and to explore, right? Explore what's contributing as we problem solve. The next communication approach that we're going to pull from in this series is appreciative inquiry, right? Often referred to as AI. And this is a very powerful framework. It's strength-based. It's a way of focusing on what is working in the relationship service provision, right? This was developed by David Cooper Ryder and colleagues, and it really kind of flips the problem-solving conversation around. Instead of asking what's broken and how do we fix it, it asks what's working and how do we grow from it, right? How do we problem solve with starting with strengths, starting to use what's working. In many of our behavioral health settings, supervision can unintentionally become problem saturated, focused on deficits, errors, crises, challenges. And human service staff are often, behavioral health staff and FCS programs can be working in high stress, low resource environments. Focusing solely on gaps, compliance, crisis creates a culture potentially of defensiveness, emotional fatigue, not only for staff, but for the supervisors too. And appreciative inquiry kind of disrupts this culture by creating an environment that's growth focused, that's collaborative and energizing, right? Um, it builds motivation from success, not fear. And so this is really strength based, hopefully restoring hope and agency and maybe even innovation. And so it helps using AI to recognize and build on their own successes, connect daily work to personal values, stay motivated. Hopefully, we see that enhanced job satisfaction, reduce burnout, improve communication, right? I remember I was working with um, one vocational specialist. Um, let's just say his name is Marcus, who really struggled with putting details into intakes into those like career profiles for supported employment. And I was like, oh, should I like jump right into like corrective coaching? But I really, paused and using this appreciative inquiry lens said, Marcus, one thing I've noticed is that your initial rapport with people is really incredible. They open up quickly and demonstrate trust. That's huge. And Marcus was kind of like very proud of this. And once we kind of celebrated that strength, um, we were then able to look at how can we use this in building out your intake information, right? How do we use that trust and rapport to explore leveraging it in his work? And so appreciative inquiry looks at defining, right, the 5D cycle: defining, discovering, dreaming, designing, and delivery or destiny. And that's, what do we want to focus on growing, defining? What has, when has this worked well before? Discovery. Dreaming is, what's the ideal future scenario? Design is, how can we build structures to support it? And then delivery or destiny is really, how do we sustain and innovate based on these successes, right? And when we think about appreciative inquiry, again, we can merge it with nonviolent communication, bringing them together and applying them to supervision. These two frameworks really complement one another. Appreciative inquiry can help focus on what's working and where we can build, and nonviolent communication can help us navigate what's not working, right? With clarity, compassion, and accountability. And used together, they can transform supervisory communication from a task-driven check-in to, growth-centered partnership. So you can use this to kind of, structure your supervision and your supervisory tools. You could start with appreciative inquiry. What's something that went well this week, right? You can start out your conversation in supervision. What went well this week? What interactions with participants felt meaningful, right? What did meetings or sessions that you had that really felt meaningful for you recently? This can help a person to, speak on their pride, their motivation, sharing some of their strengths. And then we can use nonviolent communication to navigate challenges in supervision if an issue arises, right? When I observed X, I felt blank because the program or I need Y, right? Would you be willing to? We talk about Z. And this really grounds feedback, right? And in observation, empathy, while maintaining expectations. So thinking about that, you're going to go back to your breakout group rooms. And I want you to talk with your partners, your colleagues, and using your checklists for supervision, really consider rewriting some supervisory conversations. Think about conversations that you had or that others had with you. And how would you restructure those conversations to align with nonviolent communication or appreciative inquiry? How would you reword those conversations? We'll be back in about 10 minutes. Any questions? Okay, see folks back in about 10 minutes. Let me know if you need any help getting into your breakout group room. And we'll pause the recording for privacy as we debrief our activity today. And again, right, we're looking at the formats of supervision, and individual supervision being the most common, most traditional form of supervision. And we see that it can support new staff, existing staff, interns. You can offer tailored skill development to the person. Then there's group supervision. And this is where we're bringing together the team, often within the same program, to reflect on service provision, service conceptualization, um, build skills across the team, right? It encourages peer learning and feedback. It can support addressing team challenges, reinforcing consistency for service delivery or skill development, fostering community, a sense of belonging, right? And psychological safety, if we're going back to that trauma-informed care approach. And we know in research with group supervision, it can promote collective problem solving, reduce isolation, and increase the strengths across the team. But the challenge might be managing those power dynamics that we are referring to earlier when we were kind of debriefing our exercise. activity. And lastly, there's in vivo supervision, also called field-based supervision. And that format involves observing the supervisee in sessions, shadowing them, right? Observing them, do job development, or observing them communicate with a landlord, followed by immediate feedback. And this is ideal for modeling specific interventions, reinforcing fidelity to services like supported housing or IPS, capturing teachable moments. And individual in vivo supervision can bridge the gap between theory and practice. It can be really assistive in formative supervision, helping people to build skills. And so you can ask yourself, how do I choose the right format? Typically, supervisors are providing a combination of all three. Put in the chat what format you typically provide. You can put an I for individual, a G for group, or a V for in vivo. What do you typically do? Or what do you typically receive? Going a little bit deeper, individual supervision is a cornerstone of effective practice development. Um, when we are supporting people in behavioral health settings, we can really supporting staff in behavioral health settings. This can help us to have one-on-one targeted conversations to narrow down areas for growth and development as well as strengths. We can support the service conceptualization deeper for a staff person, as opposed to when we're just maybe having a more general conversation in a team meeting. And it's really profound benefits in terms of enhancing competency, confidence, autonomy, reducing burnout, right? This is a good place for doing that restorative supervision. Again, going to that group. It's underutilized form of supervision. Do I see anything coming in the chat? Oh, individual for Shelley. Anyone else? Put an I for individual, G for group, or V for in vivo, what you mostly receive or what you do. Page all three. Great. My team has weekly individual supervision as well as monthly. Brian, I. Yeah. So I'm seeing a good mix. That's good. That's good. But again, group supports team cohesion, skill transfer through peer modeling, can support consistency in practice, fidelity, like we mentioned, shared problem solving. That peer learning, that peer-to-peer learning can be really valuable, right? Pairing practitioners, in team meeting to support each other in terms of their professional growth or peer mentorship. Great opportunities, right? And then we have our in vivo. This is often referred to as field mentoring, and it's one of the most effective yet underutilized forms of supervision. And it takes the supervisor out of the office and into the real world setting where services are delivered for FCS programs. And this means, in the potentially at employer sites or at housing sites, intake sessions, job development, meeting with landlords, wherever the service is happening in the community. And it's really critical for supervisors to get that in vivo or field-based mentoring for observation, to model. Supervisors can go out and model or coach in real time. And in vivo supervision really matters because it's related to higher fidelity of services, right? Higher fidelity to IPS services or housing services. It's related to higher skill acquisition of the staff, building confidence and professional identity, and more consistent person-served outcomes. In vivo supervision can be supportive in helping people learn complex clinical skills, especially if people are new to the role. And it really is a great way to build rapport. And one final method of supervision is process recordings. This is another powerful but often underutilized tool in supervision. Process recordings is a type of supervision where we can have staff with consent of the person served, record snippets of a session, to ultimately um, listen to in supervisory meetings, right? That could be individual supervision, that could be team supervision, where everyone, in terms of the service team, can listen to a specific tailored portion of a session to hear staff demonstrate their skills in the provision of supported employment or supported housing. I use this once monthly with my supported employment, supported education teams. Everyone would make a process recording, obviously with the signed consent of a person. They'd record in an appropriate setting, meaning they wouldn't record at someone's employer site, right? It would be maybe at their home when they were going over, off-site job coaching, something of that nature, right? An appropriate setting. And we would choose randomly who would play their 15-minute, 10-minute tape, right? Where we would listen to the staff person deliver service and process, right? What did they do well? What areas do they want to grow in for service conceptualization? How might they help this person in navigating blocks? If the person served is struggling with goal attainment, right? What creative services could we conceptualize? What are our thoughts about some of these modes of supervision, specifically in regards to process recording and in vivo? I know that can be challenging. Many staff might initially feel very defensive, hearing that they might record a session or have their supervisor observe a session. Thoughts on that?
We have tried that. Actually had them record it on Zoom and play it back. And it is amazing the impact it has on people looking into your programs, people identifying with the client who is receiving those benefits. It is intimidating at first, but when you see the results and you see how valuable that is, I agree. It is something that it is very useful, and I don't think we use it enough.
I love that. I love that you've utilized it. You've seen the profound impact that it has. When we orient staff with the understanding that this is a tool, that I am not here people are not here to judge, they're here to support,
Yeah.
that this is a supportive environment to encourage development of skill sets, to support one another in service provision, collaboration, building, growing our skills, becoming, really competent clinicians, helping individuals to build their communication skills or their peer skills, peer certification skills, whatever their particular um, credential is, to kind of like grow in that role, in that professional identity. Then setting that tone, hopefully people will kind of come alongside, and using appreciative inquiry as well as nonviolent communication can even make that setting more supportive. I put the last form that I'll be sharing into the chat, and this is the service conceptualization form. The service conceptualization form is a tool that, in addition to the other tools that we've looked at today, from the checklist to the supervisory reflection worksheet to the nonviolent communication and appreciative inquiry form, the service conceptualization form is an opportunity for you, the supervisor or supervisee, to really dive deep in one particular person. This can be used individually, in vivo, or in team, where you troubleshoot person that may feel particularly stuck. Someone who, has been in service and has been having trouble with the landlord time and again, or maybe they have had to move to different locations several times. Maybe it's the person that's been intaked and with the program for 8 months and hasn't landed an interview yet, right? It's really designed to creatively conceptualize services to move past the barriers. And so I'm asking for the next session, right? We'll have our third and final session in December to use the supervisory checklist and service conceptualization form. And hopefully we can chat about it in our next meeting. And that is where we end for our second session. I'm going to put the satisfaction survey for your feedback on today's session into the chat. Please, please, if you can complete this, that would be so appreciated. It does get reviewed. We do look at suggestions on how to improve our sessions and how to meet your needs. So if you have any suggestions on topics that you'd like after our third and final foundational session for next month, please put those suggestions into the chat so we can build out our series to meet your future requests. I'll be on for a few minutes. So if you have any questions, I'll stay on. And again, please complete that survey. I'll put it in the chat again.
So we'll get a copy of this, right? With the thing, so we can show others.
Yeah. Is there anything that you need a copy of?
I'd like the copy of the slides and the.
Oh, did I put that in the chat? I might not have put that in the chat yet. Hold on. Let me make sure I have a copy of that in the chat. If not, I'm going to do that right now.
Thank you.
And any other worksheet, yes, please share. Absolutely. Please share with folks.
Yeah.
Utilize. These resources are for you to use, to share, to discuss, to edit as you see fit. If they can help you and your work, then that our purpose is met, right?
Right.
Let's see. Is that going to upload? I put the slides into the chat. Please feel free to download those as well.
Okay. Training. And
And I'll stop recording.